When running, a certain amount of force is repeatedly impacting your feet, which travels through your ankles, up your legs to the hips and abdomen. This force is a result of your feet beating the roadway 200 times a minute. For many runners, pain may be unavoidable, although some measures can be taken with the hope of avoiding any painful sensations. Here we have highlighted the causes, treatments, and prevention methods you can take to deal with the ankle pain. Unsupportive sneakers. A typical mistake many inexperienced runners make is not wearing appropriate footwear. Wearing the wrong sneakers, be they old and battered, or unsupportive, can lead to ankle pain and discomfort both during and after running. Ensure to wear appropriate, supportive sneakers to avoid this. Tight muscles in feet. If you have tight muscles in your feet, then you may experience ankle pain after running. If the muscles in your feet are tight, you may notice it via a sensation of pain in the ankle area. Massaging these muscles with the help of a small ball both before and after you go for a running will prove beneficial in lessening ankle pain. Past injuries. It is entirely possible that a previous injury, such as a sprained ankle, that you thought had cleared has resurfaced and is causing pain. The injury may have seemed healed whilst no strenuous physical activity was being performed, but may come back when you try running. Excessive training. Long-distance running can lead to strain in muscles and tendons, as well as stress fractures. If you require high-intensity workouts of a long duration, try swapping out running for a less impactful exercise, such as rowing machines, or exercise bikes. Lack of structured motion. Within the foot, it is a very common occurrence while running, as the motion of running is linear. This can lead to ankle pain after running. Avoid this by doing ankle mobility exercises before a run. This is achieved by slowly moving the ankle in a circular motion, clockwise, then counterclockwise. Repeat this exercise on both ankles for 2 to 3 sets of 20 repetitions in both directions. Inversion sprains. The most frequent sprain that occurs in runners is an inversion sprain. This sprain happens when the ankle rolls inward, causing damage to the ligaments that reside on the outer edge of the ankle. A sprain can be avoided by practicing proper running technique and being careful, although accidents are often unavoidable. Achilles tendinitis. It is a frequent occurrence in runners. It can be caused by overactivity, improper footwear, and misalignment, amongst other things. The Achilles tendon, although being the biggest tendon within the body, is still prone to injury, especially in avid runners. Those with Achilles tendinitis will likely experience an inflamed heel, with the skin around the area becoming reddish, along with ankle pain. Blisters. Blisters are a result of friction from clothing rubbing against your skin, and are highly frequent in runners, especially those running long distances. Blisters are typically small, but can cause strenuous pain and lead to the inability to continue with physical endeavors. These can be prevented by wearing tightly fitting footwear, and ensure that your feet remain dry. You should seek medical help if the following applies. You can put no weight on your ankle when there is a visible difference in its appearance. This may indicate that the ankle is broken. The pain you experience is intense, even when the ankle is being rested. A popping sound can be heard when you try to move your ankle. If the ankle becomes infected, like the ankle becomes warm, tender, and red, or a fever of over 100 F. Your doctor will likely perform an X-ray on the ankle to determine the exact cause of the pain and the best course of treatment, which may include anti-inflammatory medication, protective and supportive gear, or possibly surgery. To deal with ankle pain, use supported equipment, such as a brace or splint. Attempt to avoid placing weight on the ankle if it is hurting, perhaps try using crutches when walking. Placing ice on the area that is in pain will help to reduce swelling as well as numb the pain. Leave it on the ankle for around 20 minutes, and be sure to never put ice directly onto the skin. Wrap your ankle for extra support with the aid of an elastic bandage, but ensure not to wrap it too tightly. If you are able, raise your ankle above your heart. You can use pillows to assist you. Perform exercises to increase your mobility. Exercise can be performed by sitting in a chair with the foot that has ankle pain after running flat on the floor, and moving your knee left to right, slowly, for about 3 minutes. If you are capable of standing without increasing the pain you are experiencing, then it may be wise to perform strengthening exercises. This can be done by placing your foot on the floor, flat, and pushing it against a wall or another immovable surface or object, and hold for 6 seconds. Alternatively, sit on the floor and place both feet side by side, flat on the floor. Push your injured ankle against your uninjured foot and hold for 6 seconds.